June 10th, 2022, and we are continuing to monitor the 2022 outbreak of monkeypox, a virus which previously had not been one that particularly spreads outside of endemic African countries, but which recently has been proliferating quite significantly in many countries outside of those endemic African ones. You can see, for example, hundreds of cases in the United Kingdom, Spain, and Portugal alone. This is something to be on guard about and to follow how this virus, that seemingly was not one that spreads particularly quickly and that was isolated to those specific countries in Africa, has now spread so far and so fast. We can see even here on this particular map, these are the countries in which the virus is endemic to, many in Central and Western Africa. And the ones pictured here in dark red are the ones in which, for now, there are confirmed cases of the virus. And it has genuinely been quite remarkable how quickly the virus has been spreading, how quickly it has been identified in different countries. We can see here from our world in data the number of cumulative confirmed cases. You can see that towards the beginning of June, the number of cases now exceeding 1,000. And it is just continuing to grow. At this point today, June 10th, 2022, or at least the morning on the eastern seaboard, the number of confirmed total cases worldwide is around 1,366. And will probably continue to grow over the next couple of days. Probably not going to receive a significant number of new cases over the weekend, but certainly by Monday, the 13th of June, we'll probably be continuing to receive more updates from various countries. And let's just have a particular look at North America. So, at least in Canada and the United States, those two countries in North America currently have the most cases. They're Canada at 110 confirmed cases, and the United States at 45. You can see here that the most recent update for both of those countries was yesterday, June 9th, 2022. Canada's epicenter currently is the province of Quebec. You can see here that as of June 8th, 2022, 98 cases of the virus had been identified there in Quebec. And Quebec has made available the smallpox vaccination to fight the spread of monkeypox virus. That's something that you're seeing many countries do, especially in Europe and North America, is giving this vaccine to people that are close contacts or people that are in any way, shape, or form related to a confirmed case, and that they might want to reduce risk of transmission or reduce risk of infection. And at least from June 8th or June 7th. This was previously a bit lower, the new cases in Canada, mostly being here in Quebec, and also a few in Alberta. This dashboard from the Canadian government not fully reflecting the new cases. Alberta at 4 cases now, after confirming its first case just a week ago. Ontario here at 9, 8 of those cases being in the city of Toronto, 1 just south of Toronto, but still in the province of Ontario, and then of course 1 in British Columbia, specifically in Vancouver. In the United States, we don't have as much cases, or at least confirmed cases, as Canada currently has so far, but nonetheless 45 confirmed cases in the United States, according to the United States Centers for Disease Control and Prevention. We can see that currently the most cases are in the state of New York, New York having 11 cases. 10 of those cases are in New York City, and 1 of them is in Sullivan County. That was recently identified, I believe, on June 7th, and that was the first case outside the city of New York. I just wanted to show this recent statement on June 9th from the New York City Department of Health, again reaffirming that there are 10 people in the city that have tested positive for orthopox virus and as such are presumptive positives for monkeypox. But perhaps the most interesting statement is anyone can get and spread monkeypox. This is quite a significant departure from earlier statements by the CDC, by the Department of Health in New York City, which just continued to repeatedly assert that the risk of transmission in the community was low. Nonetheless, the CDC did issue a level 2 alert for monkeypox virus just a few days ago, essentially cautioning travelers to wear face masks and exercise additional precautions to reduce the spread of the monkeypox virus. New York City also alerting men who have sex with men that group is at greater risk of exposure to this virus. If anything, this tweet from New York City Department of Health really suggests a different attitude now towards the spread of this virus, suggesting that transmission is easier than they had initially anticipated, and that there does need to be some precautions, there does need to be some caution in addressing to this information to the public, and also ensuring that the public knows more about the epidemiological situation with this virus in the country. And we can see that, for example, a lot of states, they currently just have one confirmed case, a lot of single-digit totals for various different states, California, Florida, Illinois, etc. But perhaps two of the most interesting ones, at least in the past 24 hours, are in the state of Rhode Island and the state of Hawaii. Rhode Island confirmed its first probable case of the monkeypox virus. It was a man who lives in Providence County, Providence being the state capital of Rhode Island. And what is interesting is that the Department of Health there in Rhode Island said that they believe this case is related to travel to Massachusetts. If you remember, the first case of the monkeypox virus in the United States was in the state of Massachusetts. Massachusetts currently having only one confirmed case of the virus. That man was treated at Massachusetts General Hospital. And it appears that the Rhode Island Department of Health is seemingly implying that there is community transmission of the virus in the Commonwealth of Massachusetts. This man has no travel history outside of the country. He only recently traveled to Massachusetts, again suggesting that there are links of community transmission that have not been identified by American health authorities in the state of Massachusetts. That being something to, take note of. Additionally, Hawaii reporting their third probable case, or third case of the virus, again in an Oahu resident, this essentially being the area around Honolulu. Sorry, this is not the right link. The third case was also in an Oahu resident. Here we are. Hawaii Department of Health making the important announcement that they suspect that there is community transmission of the virus, because this third case not being linked to patient 1 and patient 2. So Hawaii's third case really being quite alarming for the state's health officials, and suggesting again that there is community transmission of the monkeypox virus in the Honolulu area. Not clear how the virus got there, not clear whether or not it's related to the first and second probable cases of the virus there. But again, something to note. Additionally, in their statement, the Department of Health said that they believed that the person contracted the virus after attending a social gathering. The current understanding of the more recent monkeypox outbreak is that it is spreading quite quickly due to sexual transmission of the virus. And although, there's no explicit mention here of whether or not that was involved in this social gathering, there's the potential here that potentially it was just close contact, potentially it was an aerosolized transmission. It's not clear from the Hawaii Department of Health, but nonetheless the implications for that are quite concerning. So far, 45 confirmed cases in the US. The virus is continuing to spread. Recent reports from the New York Times have suggested that different Department of Health and CDC analyses have shown that some of the cases in this 2022 outbreak are linked to strands of the monkeypox virus from 2021 in the state of Texas. What that suggests is that there could potentially have been cryptic transmission of this virus in the United States for some time, though certainly right now there is much more global awareness and interest in testing and identifying and being on the look for people that make the description of someone that is symptomatic with monkeypox and testing them for that virus. Certainly expect more and more cases in the coming days to be identified. It's not clear what this will eventually mean for the community. Is this going to be a virus that is going to infect hundreds of people in the United States? We do not know that as of yet. CDC messaging, New York City Department of Health messaging, not incredibly consistent at this moment, though all we can continue to note is that virus continues to be identified in different patients in the U.S., in some cases likely as a result of community transmission because we do not know where they got the virus from, and that is a point of concern here in the United States as we go forward in managing this outbreak. Again, looking at the number of countries where confirmed cases are and the number of confirmed cases, growing quite considerably. This is an outbreak that is something to be aware of, to take note of, and to follow as it goes along. This is currently where we are, June 10th, 2022, 1,300 cases confirmed of this virus, of the monkeypox virus, and we will continue to monitor the disease as it spreads and the implications for society at large.